Hello and welcome to The Well. I'm your host, Dr. Brendan Arm, Doctor of Acupuncture and Oriental Medicine, Chinese medicine herbalist, and founder-director of Lotus Integrative Medicine in Santa Monica, California. There's a wealth of health-related information out there, and I'm joined today by this wonderful group of integrative and holistic medical doctors and practitioners to share some of our favorite wellness tips. Please let me introduce you to Bianca Rodriguez, a holistic psychotherapist, Dr. Heath McAllister, a naturopathic doctor and registered herbalist, Leona West, a clinical nutritionist and herbalist, and also trained and certified in functional medicine, and Dr. Rob Krochmal, a medical doctor and a practicing physician who is board certified in family medicine, nutrition, and integrative and holistic medicine. So let's begin. Today's topic is, how do you know if your supplements are working?
Okay, I brought up this question because I work with a wonderful functional medicine doctor over the past 7 years, and we've tried lots of different things. And what's hard is I feel like sometimes we add a few things at the same time. And when I go back in for my follow-up appointments, it's like, how are you feeling? And I'm like, sometimes it's very clear to me what's feeling different because I know that we're using it to treat a very specific thing. But sometimes I'm not so clear. And then I don't know, was it this one or was it that one? Or how do we know, guys? How do we know?
I think that's a great question. Sometimes you don't know. Sometimes it's, we don't exist in a terrarium. There's all these different factors influencing our lives. So if you're going on just based off of how you feel or your energy levels or your mood, they may be related to your supplements, but they may be related to other aspects of your life. So that's a difficult thing. It's a wild card. In any modality and any medication and anything we do, we can't discount just global living experiences. I would say for myself, we do a lot of lab testing in my clinic. And so let's say I put you on a vitamin and you're on vitamin B12. Well, I'll retest your levels and I'll check to see if you've absorbed it and if you've built up some vitamin B12 in your body and if you're at a good level. So for certain things, it's pretty straightforward, like nutrients. For other things, it may not be as straightforward. Let's say you're taking 5-HTP to increase serotonin for your mood. Well, we don't really have good testing for serotonin. There's urinary and salivary testing, but they're not really, and blood, it's hard to really measure serotonin levels and extrapolate that to what's going on in the brain. So sometimes you don't know. A lot of times you don't know. Sometimes you can test for it, and sometimes it's, really needing to be scientific about it, but only adding one new super big variable at a time, understanding there's all these other little variables coming into our lives at all times.
I would also add that when you do know, it's great, because I have patients that will come in and say, that supplement changed my life. And that's a very clear signal. When it is a situation where you've tried one or more things for a while and you don't really know if things have changed that much, then I take a step back and say, okay, is this a supplement that you really need? And maybe you don't need to do that. Certainly, as we all know, lifestyle and diet and sleep is fundamental, so nothing's going to change without that. And I try to keep the supplements to a minimum if we don't need them. There are some supplements that I feel like people really do need generally. One of those being vitamin D for most people who are really not getting enough sun at the very least. That's another one, as Dr. McAllister was saying, that you can also test for. So that was a very easy one to test for. But I also find that with that one, most people will find that they see a difference with vitamin D. Most people will say, I really do feel better with that. And there's a lot of reasons for that. So, so that's what I have to say about that for now.
Yeah, I think it's not such a big subject. So there's a couple things that come to mind. So one is some supplements or herbs, they are tonics or adaptogens, and so they're meant to work over time. So they kind of help to modulate different highs and lows in the body, and over time kind of nourish and tonify the body. And so it doesn't kind of hit you over the head in terms of, oh, wow, after a week, I'm feeling the supplement. You have to give it time. But there are some things that are meant to work in a more acute situation. So I'm just going to grabbed something that just happened this week, not even with a client, but with a family member who called me up and said she's been dealing with the most excruciating shingles for 3 weeks and it was only getting worse and she was desperate. So I gave her a protocol of lysine, C, olive leaf, lemon balm, and D, and a certain way of taking it throughout the day. And within 2 days, it broke in terms of the pain, the agony. And by day 4, she was like, it's like 90%, 95% gone. So that's something that, you know, we're looking to try to affect a big change in a short period of time. And so therefore, you know, she saw the change. She was going at the same level for 3 weeks. So there's things that are meant to, you know, impact immediately. And then there's a lot of supplements that we deal with that are meant to affect change over time. But sometimes I agree with Heath, is that you want to sometimes introduce things slowly and one at a time, especially if someone's sensitive and they tend to react. Or I have a few clients, they almost seem to have whatever the nutrient or supplement or herb is supposed to do, they almost have the opposite reaction sometimes, you know? So you want to go slowly and just introduce a little bit at a time, just to kind of get a sense of how you're reacting. I mean, the thing is that every body is different, and we are going to experience, especially with herbal medicine, but even with certain nutrients and supplements, we're all going to experience them a little bit differently. And I think that's so incredible too. It's such a fascinating thing. So yeah, it does take time sometimes, and it's just very dependent on the individual. I could talk a lot more about that, but it's such a great question, and it's so different for each person. And of course, lab testing is a great way to, when you're looking at nutrients, especially, to see how the person's responding.
Well, I would chime in there too that because each person may respond in a unique way, the importance of working with, you know, your healthcare professionals so that they can adapt based on how you're responding. You know, it may not always be, if someone is low in something and you give them a protocol that tends to work for many people, it may not work for that individual. So working closely with someone, I think, is a good idea. So I wanted to make that comment to Leona's point. But I also find, you know, from a Chinese perspective, a lot of times the supplements I'm giving tend to be like custom made. So it's a blend of many different herbs that tend to be in a powder or a liquid. And then someone drinks it a few times a day. And the purpose of that is, you know, hopefully whatever they're coming in for, whatever symptoms start to improve. That's how I know that, you know, and I think we all agree to that, you know, that you know, whatever symptoms someone having, if they're having a sleep disorder, then they seem to be sleeping better. So that's how we know it's working pretty well. Or if their energy is really low first thing in the morning, you know, and you try, and the practitioner does a good job with the patient, then they seem to wake up, you know, over time with more energy first thing in the morning, and, you know, et cetera. And sometimes it's quick, sometimes it takes more time. Sometimes it is just symptoms based, like someone's having a difficulty like an example, someone having difficulty waking first thing in the morning. But sometimes there's an underlying imbalance. And that underlying imbalance may cause many different symptoms. So addressing that with some types of supplements could have quick results, and then you see many different symptoms improving, but other times it takes time. So I'm you know, in favor of working closely, having some kind of partnership or collaboration with, you know, or teamwork with your healthcare provider to sort of walk you through all that. That's my thoughts on it.
Yeah, and really empowering your patients to listen to their own bodies, and, you know, in terms of that partnership that you're talking about, and that's where the real synergy happens, so that you can start to really trust what's happening and understand your own system.
Yeah.
I would make one other comment that I have some people that are, you know, supplements are widely distributed. You can get them on Amazon, get them anywhere. And some people come into my office on 20 different things. And no one of those things are necessarily harmful. But in my opinion, if you have so many inputs and it's almost creating almost biologic white noise in the body, that it's maybe not helping you. It's kind of just creating a little bit of static and something your body needs to process. I think we only need to be on things as long as we need to be on them. Like you're saying, Brendan, you put people on custom formulas for a time period to correct an imbalance. Once the imbalance is corrected, you might not need that thing anymore.
Right.
And so I only really want people to be on supplements in so much as they might actually need them. Or if they're, if it's a preventative thing, if they're, taking some preventative measures, that's fine. But my intention is never to put someone on something long-term, like a medication, like let's say a Prozac. People put on antidepressants indefinitely, or put on, allopurinol indefinitely for their gout. My goal is to always correct the imbalance and then have them on the minimum amount of support that they need. And they're getting most of their other support from the foundations of health. Like Rob was saying, sleep and exercise and diet. Those are the things that sustain you. Supplements are just little bells and whistles that can help dramatically, but they can also create this biologic white noise.
Yeah, I mean, it's there in the name, to supplement.
Yeah.
Oh,
Yeah.
circle. That makes so much sense.
Very
It's
well
not a
said.
forever thing. Well said.
Mm-hmm.
Well,
Great.
that's all the time we have today. If you have a topic you'd like to learn more about, let us know with a comment on social media. And also don't forget to subscribe to our The Well YouTube channel. Thank you for joining us, and please join us next time for more wellness tips. Remember, regardless of where we are, our resources in the well are limitless.